Welcome to this week's tip of the week. I'm Dr. Meagan von Holtz, and today we're going to have part 2 of our discussion on plantar fasciitis. First thing, let's talk about evaluation. If someone comes in to me complaining of plantar fasciitis, I never check just the heel and the ankle, because the truth is, they don't operate in a vacuum. It's going to make a difference if you're walking, say, on sod that's really soft, or concrete that doesn't really have much give. Or your shoe can make a difference. High heels versus hiking boots or flip-flops, they're all a little bit different. The other thing that sometimes people do consider, which makes a lot of sense, is what else is going on? Have you had a fusion surgery in your back? Or I see a lot of people with hip replacements or osteoarthritis in the inside of their knee. All of those things can change your gait, and that is also going to change the possibility for plantar fasciitis, because maybe your gait is a little bit different, more tight on one side. That's probably going to be the side that you might get the plantar fasciitis in. So when I'm doing an evaluation, one of the things I always check is motion. There's actually 26 different bones in your feet. So if they're all moving properly, that's going to really help keep the fascia soft and supple, and also this soleus muscle. If one of them or some of them aren't moving properly, then we might have a problem. So I always check that, and how I would fix that is a chiropractic adjustment. You also want to check the mobility of the muscles. So I'll show you on my arm, but if you're using to check the fascia or that soleus muscle, if you just kind of rub your hands along the muscle, you should be able to go through and not feel any bumps. If you feel any pea-size or marble-size knots in there, then that's either some trigger points or some scar tissue that's forming in that muscle. So the better we can get that to go away, the better the motion in your foot's going to be, the less plantar fasciitis you're going to have. And there's a lot of different things you can do for that. Sometimes we just do direct massage. One thing that you can do at home is a stretch. So if you just put the bottom of your foot up against a wall and lean into it for 10 or 15 seconds to really stretch that muscle on the back of your foot. If you do that every day, 2, 3, 4 times a day, that can make a big difference. Sometimes in the office we'll use ultrasound to push out inflammation. Recently, actually, we've been using this machine. We call it RRT for short. It's rapid release technology. Really the best way I can explain it is if you've ever watched a cartoon where you've got the opera singer, she's singing a note of a certain frequency and she can get the crystal vase across the room to break. This machine resonates at the frequency of scar tissue. So it makes a funny noise, but the applicator here will resonate at that frequency and actually break up scar tissue. So people who've had stubborn plantar fasciitis that just will not go away, that has made a huge difference. The other thing is, some things you can do at home, something as simple as having a water bottle. I think it's even better to have one of the soda bottles that is fat and then thin and fat. But if you fill this with water and freeze it, every morning, if you can roll your feet on it, the ice will kind of numb the area, and then you can almost push on those areas to get those knots to try to get smaller. Anyone with chronic plantar fasciitis, I would seriously do this every morning for 5 minutes and every night for 5 minutes, and it will make a difference. The third piece really is, after we get it moving better, how do we make sure it stays there? Like if you have feet that are terribly flat, it's really difficult to change that. So what we usually do is have you get an insert. Now you can walk into any drugstore and get a cheapo one, or we've got a special laser scanner that you can stand on, and a company that would make inserts specific for your shoes that will support the 3 arches in your feet. The other thing that we sometimes do, especially for people who chronically roll their ankles, we use rock tape. So you've probably seen this on some of the Olympians. I noticed the volleyball players had it on their shoulders. We put that tape in an area to help support the ligaments and the muscles, and that can help it stay over time too. So I know that was a lot to go over, different things we do in the office, those things you can do at home. You've got your soleus stretch, try the frozen water bottle. Those are 2 of the best things. If you have other questions, you can always contact us. Thanks so much for joining us for the tip of the week. I'm Dr. Meagan von Holtz.